Hi, my name is William Gresser, and I'm working with Janaki, and we are introducing our product, MedDec. Many patients with long-term and/or chronic diseases forget to take their medications in a timely manner. This problem is particularly alarming in cases where a patient's good health is contingent upon continuous medication administration. In an effort to help these patients take medication on time and track their medication, we proposed the use of a new technology called the MedDec. We feel this technology is necessary, especially after learning the benefits of a telehealth system that improves the likelihood of a patient by taking a prescription by 27%. And the context, or this product will be used for, are patients with chronic illnesses, elderly patients, ADE patients, and it can also be used as part of drug rehabilitation programs and normal health checkups. From our research, we found that 32 million Americans use 3 or more medicines daily. 125,000 die from forgetting to take their medication. 290 billion is spent in emergency room visits and other avoidable medical expenses. And about 50% of the 2 billion prescriptions that are filled each year are not taken correctly. These statistics are important because they show how much forgetting to take your medication can actually have on a patient's health and how it can be detrimental to their life. And one last statistic we found is that 1/3 of people who are prescribed medication actually take them, another third take some of them, and another third take no medications. The data for this project comes in the form of detection of medication, which turns into information once it goes through the patient monitoring system, and then it becomes knowledge in the detecting health problems or effects of medication, ADE. In 2004, the FDA approved the VeriChip for medical applications in the United States. It is about the size of a grain of rice containing a unique verification number. The VeriChip's primary uses in healthcare is the identification of patients as well as an easy access tool for EHRs. Our hope is to create a contract with VeriChip to add an aspect to the device that will come with taking a specific medication.
Hi, my name is Janki. So, you might be wondering how this technology will actually be created. We decided to make it easier. We would use the VeriChip technology in conjunction with a body sensor networking system. So what would happen is that the VeriChip would be inserted into the patient's body, and through body sensor networking, we could detect what physiological changes are happening within the person. And say a person's blood pressure went extremely, extremely low, we would be able to note that, and through a patient monitoring system, an outside source through the hospital would be able to contact the patient and try to figure out what's going on, why their blood pressure is so low. The MedDec would also be able to tell the patient monitoring system whether or not the patient has taken the medication, and if the patient hasn't taken the medication, and the alarm has been going off for more than 3 minutes, then eventually the patient monitoring system will contact the patient. We wanted to make it clear that this alert system would not be too cumbersome, and it wouldn't be another thing that patients would have to worry about. So the alert system would only contact the patient if the patient does not deactivate the actual application on the phone and saying that they've actually taken the medication. And the only other time that the patient monitoring system would alert the patient or contact the patient is if there's a significant physiological problem found. For example, if there's significantly low blood pressure or significantly high blood pressure, then those would be 2 cases where the alert system would be in good use. Since we've tried to make this technology as easy to use as possible, we realized that the training needs should be minimal. And so from the patient's part, the only thing that they really need to learn is how to use the app, which they can learn by the actual application itself, because there will be a step-by-step instruction guide, but also the doctor will know about how the app is going to be used. The doctor would have to learn how to insert the chip into the patient, but because VeriChip already exists, there's been research and development already done about this, and there's doctors that are already trained in putting in the chip into the patient's body. So that's not something that we necessarily have to learn to do from scratch. We just kind of have to latch on to the VeriChip's doctor system and use that. The other thing that the doctor would be responsible for is gathering the information from the patient's chips. So the information will be going to each individual patient record, and the doctor would be responsible, once a patient comes into the office and is inquiring about their health, to actually look through the patient's health EHR and be able to suggest possible treatments regarding their health status. Now, the hospital staff is also responsible for being knowledgeable about the VeriChip, only because if a patient did come into the emergency room, then the doctor should know that this person has a VeriChip inside of them, and it's been linking information about their medication use, and it would be especially helpful if there was an adverse drug event that happened, and the doctors need to know what was going on and what prescription was used, and they'd be able to tell that, okay, this prescription is not good for this patient, and there's something else that may be helpful for the patient instead. Now here comes the finance portion of our project, and we realized that our costs are very low because we understood the fact that research and development has already happened with this technology, and since VeriChip has already started the microchip, that we could latch onto their business, and everything would be paid for, and the basic cost for this VeriChip technology that we consider the MedDec is the cost for the patient, which would be $300, which would include the cost for the chip, the mobile application, and the training DVD. We came up with this figure because the cost of the chip is already very cheap. We found out that there's this chip that's also been inserted into animals, and this chip goes for about $10 to $50, and it's really the patient paying for the doctor costs and the insurance costs of inserting this chip, which would range to $150, and then the mobile application fees of actually developing this new mobile app, and then the training DVD, which would also be a minor cost. And also we just wanted to make it clear that the cost of injection of putting in this VeriChip into each person's skin would vary upon the location of the healthcare provider. It's very clear that if you live in an urban population, it would probably be cheaper than if you lived in a rural population to get this technology. Also, as the MedDec becomes more popular in the healthcare system, the cost may decrease in the long run, and we would like to possibly partner up with insurance companies so they could recognize that this medication system, MedDec, is actually going to help them, because if there is an adverse drug event, or if a patient's health is going down, then it would be to their advantage to know what exactly is going on to prevent major episodes of emergency happening. So it would basically help them in the sense that the insurance companies would be able to prevent future emergencies for the patient. It wouldn't work out so well if there was a hierarchy where some people knew more about the subject and some people didn't know anything at all. So we figured out that in order for everybody to be knowledgeable about the subject, we would distribute CD-ROMs, would basically have a step-by-step guide for each person, in the patient, in the hospital, and as the doctor. So all three would be kind of at the same level, and they would all know exactly what's going into this device. And we just want to make it clear that this device is meant for convenience, and it's not supposed to be another device where people have to carry around. And it's not going to be another device that people have to carry around because it will be a part of the cell phone as an application. So the current MedTech technology is simply the chip with a body censoring um, system. Now, we plan in the future to implement this technology so it would actually administer a potent dosage of medication in the patient system. So, say for example, a person had diabetes, and the body censoring system had detected that their blood sugar was low, then the chip would send out would release potent levels of glucose to help maintain the body sugar. And on the other hand, if the blood sugar was really high of a patient with diabetes, then the chip would release um, potent doses of insulin. And this information actually comes from a professor at MIT who is already beginning to develop this technology. And I find it to be very useful because if a patient does have high or low blood sugar and needs to get to the medications quickly, and say, for example, they're in a meeting or something like that, they're not necessarily going to want to take out their insulin medication right then and there. If the body can just do it for itself, then that would be extremely, extremely helpful for the future of healthcare.